My first role as a consumer representative was at Sydney Local Health District as a patient representative or a consumer representative. I got involved because of a personal experience, and I thought that given our personal experience, I thought there was an opportunity for patients to be able to share what it's like being a patient going through our health system. And I had years of experience of that. So that's how I got involved.
42 years ago, I was diagnosed with Addison's disease, which is a rare and significant chronic illness. And there wasn't a lot known about it, in fact, virtually nothing. And so I started a Sydney support group. And my consumer rep experience sort of came from that.
The Daily was putting out a call for consumer reps to go on a committee with the Northern Sydney Health Service to discuss the planning of health services for the next decade or so. And this was the early 2000s. And ultimately, although that wasn't stated at the time, it was part of the plan that would lead to the new Northern Beaches Hospital. So I just put my hand up, having really no experience in health prior to that, other than for the fact that I'm somebody with cerebral palsy who had been in and out of hospital multiple times as a child with multiple orthopedic surgery experience. But on the basis of nothing other than that, I applied for one of the community seats on this committee, and surprisingly, I guess I got it.
I probably didn't recognise it as a consumer representative role, but the very first thing I did was edit a home birth magazine. I did that because for me, my consumer representative journey started when I got pregnant. Like many people who enjoy good health, I didn't really have much interaction with the health system until I was pregnant, but I did a lot of research, and I felt that what I would really like is a drug-free delivery if I possibly could. I found it to be quite difficult to achieve, and I wondered why something that is evidence-based, such as continuous midwifery care and use of labour and water, was so difficult to access. So that's sort of where my journey started. And a friend said to me, I think you should edit the magazine. It was called Birthplace, and that was my very first volunteer role. And I look back and I see that also as my first consumer rep role, and I wanted to make a difference.
The first role that I had was back about over 5 years ago now with the Sydney Health District on their Research Ethics Committee as a layperson consumer representative. Reason for participating was I have a strong background in consumer experience, both commercial but also in the not-for-profit sector, as well as lived experience with the health sector, and also across an ethics and research background. I have a very strong desire for supporting social inclusion where I can. And they're really the key reasons of me having an opportunity to actually participate and ideally make a difference.
Started as an advocate in the cancer field, having a lived experience of leukemia. So my first experience, I guess, was doing training with Cancer Council New South Wales. And through that, I joined Cancer Voices New South Wales.
To be honest, I don't have a consumer leader model, because when I joined about 8 years ago, I actually had no idea what a consumer representative was. I had no idea what the actual function was. I just knew why I chose to do it. And I chose to do it because I was a family member. So I was the daughter of a man who went through the health system for over 10 years, and how he experienced the health system as a patient, and also how we experience as family members who were actively engaged in his health. He was actually my role model. It was because of him that I continue to do what I do. And it's because, and he actually inspires me. He inspires me actually every day. And so when things get tricky, because they will, as a consumer rep, you have to be prepared to understand we're evolving our understanding of how to be a really good consumer rep. And sometimes when it gets hard, I look to my dad and he inspires me to continue. And that's the gift that he's given me.
My clear answer to that is Betty Johnson. Now, everybody knows Betty Johnson. And we made a strange odd couple because we came from opposite ends of politics, really, if you looked at both of our histories. But we came together more often than not on dealing with health issues. But we were in furious agreement far more often than we were ever in disagreement. She managed to use a theory that another friend of mine gave to me, which was speak softly, but carry a big stick. And I saw Betty use that countless times. She could make a point and everybody else in the room would know that she was right, and everybody else in the room, particularly if they were a clinician or a senior health bureaucrat, would know that they'd just been outsmarted or outgunned.
I would say that my consumer leader role model in West Australia is a woman called Margaret Doherty. So she inspires me on a lot of different levels. So she brings her lived carer experience voice to the table so eloquently. She makes sure the carer voice is not forgotten. She is always up for the courageous conversations, and she is also, I think, incredibly effective. I think that, you know, when she undertakes a project, you go, gee, that was good. And, you know, co-design is something that's talked about a lot in the West rather than done. But as much as co-design is done in the West, often Margaret's been part of the project.
And what I find makes them inspirational and really bringing everybody along for the journey is that they have perspective, they have passion, they are very effective communicators, they are insightful problem solvers, and they come from an informed opinion. So if they don't know, they go and find out. So they can help us position what we are doing in order to achieve the best outcome. Sally
Crossing, who unfortunately passed away in 2016, not long after I had the privilege of meeting her, set up Cancer Voices New South Wales and a lot of other, established a lot of other consumer initiatives in New South Wales and Australia. She was incredibly networked and politically connected person, got a lot done. And I'm now on Cancer Voices executive. I joined that after her passing, and it's really great to see somebody's legacy continuing.